New this morning, if you have COVID-19 and booked an appointment for a monoclonal antibody treatment, or if you were considering it, that's no longer an option. That's because the Florida Department of Health is shutting down all state-run monoclonal antibody treatment sites.
The move comes after the FDA revoked its emergency use authorization for some treatments, saying that monoclonal antibody treatment does not work on the Omicron variant. Governor Ron DeSantis released a statement overnight saying this indefensible edict takes treatment out of the hands of medical professionals and will cost some Americans their lives. News4JAX reporter Brianna Andrews live for us this morning. Brianna, the announcement is impacting new treatment centers all across the Sunshine State.
And that includes this treatment center right behind me. This is the Southside Senior Center on Beach Boulevard. It is one of the centers that shut down. And we were here last week when people lined up for the first day of treatments. But just like the other centers across the state, these doors are closed to patients until further notice. Now, the FDA says Regeneron and Eli Lilly's monoclonal treatments are not effective against the Omicron variant. The agency hopes to avoid potential side effects as more research is conducted. With this option no longer available, the state is encouraging people to seek out what it calls emerging treatments on its new website, healthierufl.com. If you click on the COVID-19 tab, it shows a list of recommendations. Well, we spoke with infectious disease specialist Dr. Reza, who recommends sotrovimab as an additional treatment option.
Those are other fantastic options that are available. They're available in limited supply. So sotrovimab, which is a monoclonal antibody, that does work to decrease your risk of hospitalization and death by 85%. Remdesivir, which is another medication antiviral, that can be used in the outpatient setting to decrease your risk of hospitalizations. And there are other oral medication, Paxlovid and another medication by Merck, that have also shown to reduce your risk of hospitalization and death.
The state's new website doesn't mention sotrovimab. Fluvoxamine is listed as a recommended alternative treatment option. It is a pill approved to treat obsessive compulsive disorders, often prescribed to treat anxiety, depression, and panic attacks. Studies have shown it is highly effective at preventing hospitalization in COVID-19 patients. Another is inhaled budesonide. That's a steroid found to improve the condition of patients infected with COVID-19. The state also recommends taking supplements to guard against COVID-19, zinc, vitamin D, vitamin C, and quercetin. Now, it is important to note, according to the National Institutes of Health, that there is not enough data to recommend or not recommend to use any vitamins to prevent COVID-19. Now, of course, it is very important before using any medication to speak with your doctor. Reporting live, Brianna Andrews, Channel 4, the local station.